Welcome. During the next few minutes, we will talk about varicose veins, spider veins, and venous insufficiency. Then, we will talk about current diagnostic and treatment options. First, let's learn about your vascular system. Your heart pumps oxygen-rich blood and nutrients through arteries to all parts of your body. Deoxygenated blood, along with waste products, is collected by the veins and sent back to your heart. Leg veins are far away from the heart and have to work hard to push your blood upward against gravity. To make matters worse, many of us have genetically weak veins. Yeah, thanks, Mom, thanks, Dad. Now, if you add more risk factors like standing or sitting for long periods of time, pregnancies, excess weight, and increasing age, you can see how easily leg veins fail. As veins begin to fail, blood pools in them. The increased pressure in larger veins is transferred to smaller veins all the way out to the skin surface. Some of these diseased veins can't be seen at all. Some appear as bluish ropey veins on the surface, and some appear as spider veins. We will discuss spider veins in a moment, but for now, let's talk about the deeper varicose veins. During the initial stages, patients usually notice only mild symptoms such as heaviness, tiredness, and aching that worsen by the end of the day. The onset of symptoms is so gradual that many people forget how their legs felt before they had problems. As veins deteriorate further, these symptoms become much more noticeable. You may experience additional symptoms such as itching, burning, numbness, cramping, and restlessness. The next stage is swelling in the ankles, feet, and legs, followed by discoloration of the skin. If left untreated, this can result in complications such as blood clots, bleeding veins, frequent skin infections, and sores that are slow to heal. Not all is lost, though. A majority of our veins are healthy and are supported by our muscles, forming the deep venous system. Less than 10% of our leg veins are located outside the leg muscles, forming the superficial venous system. It is typically this system that fails. We can make the determination during your ultrasound mapping. Let's talk about the mapping appointment. During your initial consultation, your vein specialist may recommend a diagnostic ultrasound scan, which creates a detailed roadmap of all important veins in your legs. We check the deep veins for problems such as clots or obstructions. Then, we check your superficial veins to see if they have failed. Our vein specialist will then go over treatment options with you. In the past, treatment options were limited to surgical vein stripping or injection sclerotherapy. Now, FDA-approved laser technology allows us to treat diseased veins at their source safely and permanently using endovenous laser ablation, or EVLA. Here's how EVLA works. Under ultrasound guidance, a thin laser fiber is threaded to the source of the diseased vein. As the fiber is withdrawn, laser energy is delivered with pinpoint accuracy, sealing the diseased vein from the inside. The procedure is safe, almost 100% effective, and does not require any downtime, allowing patients to return to work or almost all routine activities immediately.
I had laser treatments done on my lunch breaks and went back to work and finished my shift. They did the laser treatment on my thighs where I had the most unsightly veins. It was literally after the laser treatment, sat up and looked, and it was significantly flatter. And then by the next day, even better in appearance.
With this procedure, it was painless. I didn't have any pain. And I didn't have any downtime. I went to work right away the next day. I could go home and I could walk or bike or do whatever I wanted to. So it was definitely a much better procedure to go through.
Depending on the extent of the disease, more than one EVLA may be required. Our unique 4-step numbing method ensures that the entire process is as comfortable as possible. Our pre-treatment process assures that you will have the highest possible level of comfort. Once the major diseased veins have been sealed using EVLA, the remaining smaller veins are treated by injecting a medication or sclerosant under ultrasound guidance. This procedure is called ultrasound-guided sclerotherapy, or USGS in short. Typically, your first USGS appointment will be in 2 weeks after your last EVLA treatment. More than one USGS visit may be required. Once all diseased veins have been treated, we advise you to return for follow-up visits at 6 weeks, 3 months, and 6 months. During these visits, we scan to make sure that all diseased veins have remained shut while your body slowly absorbs them. This way, we can be certain that your treatment is successful. Now let's talk about treatment of spider veins. Earlier, we mentioned that spider veins are a smaller version of varicose veins and are visible on the skin's surface. Once their source vein has been sealed, they are most effectively treated using sclerotherapy. For the smallest spider veins, or visible veins that are too curvy, sclerotherapy may not be a viable option. For these veins, we use a breakthrough treatment called VeinGo, which delivers high-frequency energy to the outside of the vein wall through a hair-thin probe. The energy is just enough to seal the spider vein without damaging the surrounding tissue. VeinGo is safe enough to be used anywhere on the body, including legs, feet, chest, arms, hands, and face. Your vein specialist will advise you to wear compression stockings during the course of your treatments. These help keep blood flowing correctly and reduce any swelling until healing is complete. We have a wide variety available so you can get the perfect fit. For your convenience, our billing staff will verify your benefits and discuss your coverage and payment options if needed. Treatment of varicose veins and venous insufficiency is covered by almost all insurance companies, including Medicare. Spider vein treatment is considered cosmetic and is not covered by insurance. Our dedicated team of billing and insurance experts will help you every step of the way so that you can focus on what is more important, your health and your legs. We specialize in treating vein problems. That is all we do, all day, every day. We have treated over 10,000 patients who now enjoy lives that have been transformed by healthier legs. Many patients came to us after exhausting all other treatment options, including vein stripping, injection sclerotherapy, or even newer treatments like radiofrequency ablation.
The biggest difference in the treatments, the swelling throughout the leg is down after the 3 treatments.
The old way of dealing with veins was totally different from this wonderful laser treatment.
Anyone who's out there today who has varicose vein problems shouldn't wait. They should get them treated right away. The technology that's out there now, you can take care of it on a lunch break. You can get your legs fixed right away and start living a life that makes you feel better and healthier. And just don't wait. Get it done. I waited too long.
From your first phone call to your last visit, you will notice that we are different. Patients become our ambassadors.